Almost every patient asks me the same question before flying to Costa Rica. Do I need an All-on-4 or do I need an All-on-6? And the answer always surprises them. Neither one, until we do an actual clinical examination. What does All-on-4 means really? All-on-4, it's a system that supports a full set of teeth anchored by 4 dental implants per arch. It is a revolutionary principle that anchors the farthest implants to support more load and to extend the teeth a little bit farther back in cases where we don't have enough bony structure to support vertical implants. All-on-4 doesn't mean minimum amount of implants. It means a specific protocol for patients who don't have enough bony structure where their molars used to be. This way, we can skip some important anatomical structures such as the sinus cavities and the mandibular nerve. When is an All-on-6 needed? That 5th and 6th implant provide more stability and support the stress better on the bite, allowing more amount of teeth in certain cases. It's commonly indicated when patients bite strong, when there are parafunctional habits such as bruxism, and when there's enough amount of bony structure towards the back of the mouth. It is not more implants the better, it is specific protocol for a specific type of cases. What really determines which one you need? Bone volume and density. This is determined by a 3D X-ray, cone-beam CT, or CT scan. The available bone anatomy and the distribution, bite forces, and patient's habits. It is not one size fits all. It is not the more implants the better. We need to analyze each case, go through the 3D X-ray, and do a clinical examination to determine if the patient fits for an All-on-6 or in this case for an All-on-4. What is the myth that causes more damage? The myth that more implants do better. This is not clinically accurate. The major goal is long-term success, functionally and aesthetically speaking, not more implants. Some clinics use the argument, more implants for better result. This is a great marketing tool, but not really a protocol that really works. How do we do it at Meza Dental Care? First, a virtual consultation, then looking into a CT scan. This can give you a really accurate diagnostics, but we finalize the diagnostic only with a clinical examination to confirm the estimate that we have sent previously. It all starts with a telephone call to understand your case better. Also, looking into a CT scan can give us the accuracy of giving you a previous estimation and diagnostics. And finally, a clinical examination is going to determine exactly what needs to be done. First, a phone call is going to let us understand your case. Looking into a CT scan is going to give us the right amount of bone and the location of it to give you a proper diagnostic and treatment plan. Finally, when you visit us, we do a clinical examination to understand the biting forces and confirm or modify that estimation to proceed. The advantage of having an in-house lab allows us to design your prosthesis before we place the implants to assure the ideal function and aesthetics for your specific case. We see a lot of cases that have been sold on All-on-6 at home, but when we analyze the case, we understand that All-on-4 is all they need, but this is done under the right analysis only. At the end of the day, the question is not All-on-4 or All-on-6. It's what is the right protocol for my case? And that can only be determined by a real professional diagnosis. If you're considering this type of treatment, the first step is filling out the form in my link in bio. My team will be glad to schedule a free telephone call with me. We can review your case and give you your options.